Let's go now to Joseph Bernacki, who's live this morning at Siloam Mission. We're thankful this morning for all the volunteers helping to make Thanksgiving happen there. Joseph, good morning.
Good morning, Rochelle, and good morning, Manitoba. Yeah, it's been a great morning here at Siloam Mission. Lots of volunteers in a number of different departments, not just the kitchen department. I'm very pleased to be joined by Dr. Heather Watson. She's a volunteer here at the Saul Sair Health Clinic. Thank you so much for your time this morning.
It's my pleasure to be here.
For people who haven't seen the clinic here before, talk to us about why this is such an important resource for people that access Siloam Mission.
So inside the shelter space, we have this extensive clinic. It's like this little jewel that I think people don't always even know is here. We have like a full clinic. We have, foot specialists. There's a dentistry suite. There's a chiropractor, and I'm an OBGYN, so I provide women's health care. And there's this full spectrum of care for folks tucked away in a space that they don't have to go trekking out in the cold to go find. They don't have to necessarily have their health card. One of the things that folks often are challenged by when they are living with unstable housing is they don't have their own ID, but that's not a barrier to care here. And sometimes people have had difficult experiences with healthcare in the past, and that can make going to a hospital or a traditional clinic feel intimidating. This is a really welcoming space, and it just decreases those barriers to care.
And doctor, you were telling us a little bit before you were live, you work at HSC. What led you to volunteer and come to work for this clinic?
Well, I have a subspecialized practice where I look after folks that have what are called psychosocial complexities. So either their mental health or their social well-being have things that are unstable during the time of their pregnancy. And I know that can create some barriers to care, and a lot of my patients live with unstable housing. And so sometimes it's hard for them to come to me, and I wanted an opportunity to come to them. And so I called up Siloam and I said, is there room here for an OBGYN? And they said yes, and they keep saying yes, and it's a great place to work.
I imagine it's been pretty fulfilling over the last year. You told me that you've been doing this.
It's been a really great experience, partly because it's important, necessary work. I am excited to get out of bed to come here, but also because the people that are working here really want to work here. And there's something really contagious about that kind of enthusiasm and people having passion for their work.
Plus, you have a beautiful mural to look at every time you walk through these doors.
I do, but also a lot of smiling faces. So it's a good view all the way around.
Dr. Watson, it's been a pleasure to have you on our show. And of course, there's so many different volunteering opportunities here at Siloam Mission in a lot of different departments. We're going to have more information, of course, on a link on our website. And from all of us at CTV Your Morning Winnipeg, have a happy Thanksgiving.
You too, Joseph. Thank you.